Hello, everyone. Welcome to this month's Cybersecurity Insider program. We're happy to have you here today. Today's topic is the anatomy of a breach and lessons learned. And the intent of this is not necessarily to inform you of breaches that have happened, because I think everyone's aware of some of the most common ones that have been in the news lately. But we want to take a look at those and determine what can hospitals do to learn from those, and what steps can you take to improve your cybersecurity program. So that's the approach that we're going to be taking today. I'm Laura Pursley. I'm the marketing director with CloudWave, and joining us today is Jonathan Bice. He's the senior security architect at CloudWave and also a former hospital CIO. And also joining us is Guy McAllister, the principal cybersecurity advisor to CloudWave. And he is also a former hospital CIO. So they will be bringing a unique perspective from the hospital CIO side, as well as they're both involved in doing our maturity assessments and risk assessments. So thank you, Jonathan and Guy, for being here today. So what are we going to review today? We're going to take a look at 3 different types of cyber attacks that have happened recently. We're going to talk about the Ascension Health attack and what we can learn from that. We'll talk about Change Healthcare. And one you may not be as familiar with is the Synovus attack that happened just this month in London. And for each of these, we're going to talk about the following questions about what could have been done to prevent these, what can you learn from each attack and adapt to your situation, and what incremental changes can you make in your processes. And then from a broader perspective, how do you evaluate attacks that we see in the news every day and have a process in place to quickly evaluate those and identify changes that you can make in your own organization. So the first one that we're going to take a look at is the Ascension breach. And just as a reminder, the cause of this was an employee clicked in a link that they thought to be credible. This is the age-old phishing example textbook. They thought it was credible. They maybe even did some due diligence, but ended up clicking in the link anyway. And the overall impact to that was that out of the 25,000 servers that Ascension has, 7 of those were compromised. That may sound like a small number until you realize that that really still impacted all 142 locations, and that caused them to be down for more than 5 weeks. I thought it'd be interesting to take a look at the timeline for this one, because there are a few differences for this than what we've seen for some other attacks. May 8th, the ransom attack was executed from clicking on that link. There was an impact to all clinical operations and business associates, and their emergency rooms went on divert. May 13th, they confirmed that there was an impact to all 142 hospitals. And then fast forward to May 24th, they still had downtime procedures in effect, and first lawsuits were filed. And this to me seems a little bit early on and from some of the other breaches that we've seen, but it could be a trend going forward that people are quicker to file lawsuits when this type of thing happens. And this particular one on May 30th, the union petitioned Ascension to improve patient safety. And we're going to go through some of those things in a moment of the specifics of that and what we can learn from that. June 5th, they did restore access to 5 markets to their EHRs. And then finally on June 14th, they were able to restore access to all of their locations. So that total timeline is more than 5 weeks. Typically, when we look at testing and looking at downtime procedures, people sometimes only plan for a couple weeks at a time, but what we're seeing is 6 to 8 weeks is now becoming the norm for downtime.
Yeah, Laura, that really stands out. And when we're doing these risk assessments, these auditing, what we see in DER and disaster planning or testing is typically an hour or 2, maybe when a patching window happens, but really thinking beyond that of, are you ready for that extended downtime? And not only that, thinking about who are you training when you're working through your downtime? Usually that happens at night. So how are you including daytime nurses or even the weekend shift who often are not included?
And Jonathan, that's a good point too about the extended workforce and are they part of training? And often hospital organizations do tabletops or training scenarios based upon a very limited downtime. Rarely do we delve into what happens when you're down for multiple weeks and how do you address that. And throughout the course of today's webinar, we're going to be discussing some of those things that need to be considered as you look at lengthy downtimes and what the impact of that could be. But you're right, training of staff that are, whether they're PRNs or weekends, other shifts that are not part of your daily training needs to be considered.
And as we continue to look through these, you'll see that what we're seeing is consistency in longer downtimes. I think all of the things we're going to look at today have those extended downtimes. So it's very important to take that in and in your planning, make sure you're continuing to think about those extended downtimes.
Absolutely. And let's take a look at, from the Ascension attack, there was a lot of information that was put out publicly about how the staff was feeling about the cyber attack. And here's just some quotes that were published and from what the union was sharing, that the clinicians were expressing that they were under incredible strain. They were having trouble because of the burden of paper charting that they may not either be used to or have been trained on. And because of that, they were saying that patients' lives could be in danger. And they were actually having to rely on patients to disclose all the medications because they didn't have access to those records. And they couldn't see lab results and things like that. So I think everyone knows that these are the situations when your EHR is down, but thinking about that, these types of things and the impact to the staff and how it's impacting patient care needs to be considered. So as a result of that, the union did an online petition to the healthcare staff, and 116 nurses and medical staff signed that, stating these specific concerns and challenges that were created.
I think
go ahead, Jonathan.
I think something that's very important on this slide is that bolded statement at the top that says patient lives are being put in danger. And we said we do risk assessments, but we really are driving more towards maturity modeling and believe that that is a better approach. Because when you look at risk assessments and you look at HIPAA, those things really are looking at keeping the data protected, keeping the data available. But we're seeing these attacks impact patients' lives. And that's one of the things we're recommending is that you look beyond just the IT, that this moves more into the clinical aspects and really putting patients in the forefront in your planning.
Yeah, and I was just going to say, tabletop exercises, any type of training for incident response, downtimes, disaster recovery, all of those today should become less IT driven, more organizational driven. We all need to be thinking about patients first, families second, and then communicating throughout the organization to the staff the status of things. Bringing systems back up, yes, they're important, but they're not the most important thing on our checklist. Taking care of those patients that are there are.
Yeah, and that brings us to the demands from the union. So this was during the attack, probably, I shared that timeline several weeks in, and some of these demands, as we go through them, you will probably think, well, these are things that we have in our incident response plan, and they likely did too. But the question to ask is, were they operationalized? Were they just in a document somewhere and no one knew how to implement them? So the first one is daily shift huddles to ensure effective communication and information sharing. That seems like it would be a no-brainer, but if that wasn't happening, then there was a breakdown between the incident response plan and the actual situation. regular training sessions for staff to improve their knowledge about how to navigate the cybersecurity attack. So, and remember, these demands were in process of the cyber attack. So you can imagine if you didn't have this in place, having to scramble and then come up with, well, how are we going to train these hundreds or even thousands of staff that we have across these locations? And then the union asked for the staff members to receive weekly reports on the progress of restoring the EHRs. Again, this would be a fairly easy thing to do if you had it set up ahead of time, but doing it on the fly in the moment during the attack poses a challenge. And the union also asked for elective surgeries to be postponed or reduce the ones that were elective. And I know that hospitals do not like to do this. This is an impact on your revenue. This is, you don't want to send patients away. Patients still need these surgeries. So again, having a plan for this in place ahead of time. And then they asked to implement a maximum of 4-to-1 nurse to patient ratio. The nurses were complaining that they were overwhelmed and had too many patients. And 4-to-1 may seem like a small ratio. And I think they were meeting within the cyber attack time frame to look at that. But again, trying to do this in the middle of the attack poses a lot of challenges.
You know, part of this, Laura, reminds me that, and Jonathan and I see this on occasions too, we're well trained and well equipped to handle those disasters that we have historically identified, whether it's tornado hits, that we've known organizations to be directly hit and they come through that, floods, where I am in Florida, hurricanes, just different types of disasters that are natural disasters. And we're well equipped, but it takes an organization that's been through a ransomware attack or some type of significant cyber attack to realize that cyber attacks are just as devastating as a tornado hit or a hurricane. The brick may still be there, but the damage inside and the damage in the community could be just as significant. I think about what it would be like to be a frontline staff up on the floor in the clinical world, and you're in week 2, not hearing anything, but all the systems are down, emails down, nothing's working still, and all you have to go on are rumors and innuendo. And those are the same people that are in grocery stores and churches and Walmart and Target and other places in the community interacting with neighbors. It's so important to make communication internally a priority. You know, we do it externally, but let's make that internal communication an ongoing thing when we're implementing our incident response plan.
That's absolutely right. And what really stands out to me is that second bullet of training sessions for staff members. A lot of times in the incident response, we plan how to react to the incident, but have we really identified what those systems, those critical systems are? Not just the IT systems, but you know, third-party providers or other systems. And do we have staff trained on how to react when those things are not available? So you have to think beyond what I think we traditionally do in our training and think about what all is going to be impacted by this cyber attack, and especially based on some of these things that we're seeing.
Yeah.
So taking those examples and trying to think about from your own organization, you know, how do you turn those learnings into actions? What can you look at on your side? So looking at staff communication, like we just mentioned, you know, identifying the types of attacks that we're talking about, or I'm sorry, the types and frequency of communication that you want to do internally and externally, and getting down to the level of who's in charge of creating the communication, delivering it, and who does it go out to? Are there different things that need to be communicated to different groups, things like that? The whole goal for all of these is thinking of this ahead of time. regular training to improve staff knowledge before an attack happens, not during. Reporting on progress to the staff, like we just mentioned. What's your plan for determining, which surgeries get postponed, or if you need to divert? And what communication are you going to provide to staff and patients regarding that? And do you need to set a different nurse to patient ratio during an attack? And how do you accomplish that?
Right, and what the measurement is on when you implement that. And I look at regular training. Guy and I, we do a lot of assessments. And one of the things we see is a lot of cybersecurity training is still on an annual basis through some kind of an LMS system. And that's really not going to be effective. What you want to look at is really spreading that up and breaking it up into smaller sessions throughout the year. That is more of a best practice that I think could more prepare you when an event happens. Don't rely on the annual training through an LMS.
I agree, Jonathan. I mean, there are examples that you see all around, brown bagged lunches, lunch and learns, monthly newsletters. There are vendors out there that provide snippets and testing of various security areas, cybersecurity included, that can be put out once a month. In today's organization, with the focus being so healthcare specific right now, a minimum of once a quarter, a minimum of that for some type of ongoing training and awareness of cybersecurity is important. And Laura, I just want to say at this point, because it really, for everyone, I think it's the chief thought process that Jonathan and I both see and share, and that is, over the years, we have been very HIPAA specific. HIPAA privacy, HIPAA security, meeting those guidelines. Let me just say that while HIPAA is important, if your cybersecurity focus is really your HIPAA security focus, you don't have a cybersecurity focus. You really need to elevate cybersecurity right up to the top. I mean, HIPAA, we have regulations we have to do. Cybersecurity is just good practice, best practice. I encourage you to just have a self-exam, if you will, on how important in your organization is cybersecurity awareness, and is it treated just as important as HIPAA?
That's a good point, Guy. And I say we do a lot of assessments. We're seeing a lot of NIST 853 assessments that are that next step, that take you a little bit further, and organizations are adopting that framework as their cybersecurity framework.
Yep. And by the way, the expectation is organizations are following some best practice, whether it's NIST 853 CSF or whether it's HHS 403, 405D. There are best practice standards out there. And my encouragement would be, look at that. You can't, if your best practice is something you've defined, that's not a best practice.
Exactly. Thanks, Jonathan and Guy. So it's just some questions to consider, either related to this breach or just in general, that goes along with some of the things we've already been talking about. How long are you prepared to have your EHR down? Do you know what number that is? Do you know if you're prepared for 2 weeks or 6 weeks? And what is that gap, and what do you need to do to close that gap? Have you tested staff communications and procedures? Is everyone on board with the plan and what needs to be communicated? Do you have the training in place, like they said, not only for your IT, but your clinical staff? Do they know what to do in the event of a cyber attack? Can you order supplies during downtime? I think that was one of the things that happened recently in one of our tabletops, that they discovered that they had no way to order supplies when they were down. They couldn't get to the information to order what they needed. And do you have any procedures that reduces the strain or burden on your staff, whatever that looks like? And putting these precautions in place prior to a breach happening. And then looking at your backup and recovery plan, is that sufficient to bring your data back online and get, or at least get access to pertinent information during a breach?
I think that last one is really something that there's opportunity to improve on that we see across the board. Is a lot of time backups don't get the attention they need. And beyond that, disaster recovery or business continuity becomes more of a check the box exercise. And these are very important to focus on, because we know that no matter how good all of the controls we put in place are, there's still that opportunity and likelihood that someone's going to get past them. And I think across the board, we see that a lot of organizations have opportunity to improve those disaster recovery planning, testing, and making sure that they're ready for an event to happen.
And also, when we look at how long are we prepared to have our EHR down, a couple of things to think about. Are you able to ramp up once you're restored and your EHR is functioning? And by ramp up, I'm talking about patient access to get patients in the system that have been on paper so they can be charted on. But the other thing is not just your EHR and the challenges that are presented with that, but if you're experiencing a ransomware attack like these examples we've given, how do you make payroll? How do you write checks? How do you deal with those day-to-day kinds of things? And then the other thing I would just highlight real quickly is on communications. If you're taking care of the patients that you have, if you're admitting patients, which is, that's a leadership decision, but are you transparent with the patient and the patient families about the status? Because we've seen evidence of lawsuits of patients being admitted or being kept in a hospital and not being informed of the current situation, that all electronic systems are down, and then there was a death. The point being is, this is a time we have to be transparent as well, and denying that anything is really happening doesn't strengthen our position. I mean, we need to let patients, family, employees, everyone know what's going on every step of the way.
I want to touch on the EHR being down and then going beyond. As Guy mentioned, when a system goes down and it comes back up, all of the patients have to be entered in for them to be able to care for them through the EMR. And if you look at a period, in a downtime testing of 2 to 4 hours, there's a good bit of documentation that has to be entered. Usually the next shift can pick that up and take care of it. But if you've been down for 6 weeks, you may want to consider adding additional staff, having that in your incident response plan to bring in additional staff to help get those charts entered. And this is, again, when we go beyond the IT department, when we're thinking about incident response, is should there be a team that's available during an extended downtime that's going to be able to help get that documentation in to get everything available within the system.
Yes, exactly. And Jonathan, we had a question come in about the EHR down. It says, is this for an on-prem EHR or a cloud EHR?
Well, it really isn't going to matter whether it's a cloud-based or EHR-based. You're really going to handle the incident the same. And correct me if I'm wrong, Guy, but anytime the EMR goes down, you're going to have similar response in your incident response.
Yes, and I would say the advantage to the cloud base is you have you have a vendor to help you through that process when you're in that type of situation. But if your files are infected and you're locked, the location of where that locking occurs and ransomware doesn't matter. Being in the cloud doesn't make you impervious to that, but it does give you a resource that if it's on-prem, you may not have at your beck and call.
We're also going to look at a later case that goes beyond just the EMR. You got to think about all clinical systems. So what happens if your cath lab is hit during the middle of a procedure, or maybe your lab system is affected, or your telemetry system? You have to think about all these different systems, not just the EMR, when you're thinking about your incident response. And a lot of times those areas fall under different departments. Typically it would be a biomed or other department. And does your incident response include those departments and prepare them for any kind of incident?
Well, and in real life scenario, I mean, I experienced, it wasn't a cyber attack, but it was a failure of an ER system back when those days when we had different systems out there. And I remember the nurse in our ER was in tears telling me, you can't go down. And I said, I have no choice, we're going down. And they went completely blind. Before they could print anything, it happened so quickly. They didn't know who was in which treatment room, who was having the heart attack, who was having the ingrown toenail, what the radiology results or images were, EKG or anything. They were completely in the dark other than what their memory recalled. And I remember as a CIO, I was sick. And that was just one ER system, not a full EMR. But remember, these things don't happen with a lead time and we ramp up to it like we do a major upgrade or things like that. This happens suddenly. And all of a sudden, there you are. And so going blind that quickly on a clinical system, I hope no one has to ever experience that.
So when I think about the question, and whether it's on-prem or in the cloud, really what my suggestion would be is think about the EMR, whatever location it is in, and all the integration and all the other systems, and really thinking through each one of your clinical systems and setting up a risk analysis or doing business continuity for your critical applications. That's really where you need to focus, because where the architecture exists is not going to matter as much as the integration and what systems are impacted if there is an event.
Yeah, and that brings us to, reiterating what Guy was just talking about with, the patients being impacted and everything we've been talking about, and taking a different approach to incident response than what has, been taken in the past, where we're focusing on getting the data up and really focusing on the patients first, and how are the clinicians going to serve those patients. So patients and staff first, communicating with the family, and then bringing up the systems. Now, there are things that can happen in all of these, overlapping, but really having your incident response plan considering the patients before even the data. So prioritizing patients, evaluating what does the staff need to be able to treat those patients. Do they know how to work from paper? And then addressing those family concerns. And then in your incident response plan, in the moment of a cyber attack, auditing or documenting what you know and what you don't know. And that will help drive towards the next action that you need to take. And then finally considering the systems and what you need to do there. So we did a whole incident response webinar, I think it was in February in the Insider program, around this topic. So if you didn't participate in that one, we can send you the recording of that. That dives a lot deeper into how do you do these things. It's easy to say consider the patient first, but there are very specific things that need to happen to change that process in your organization.
And Laura, they all really, they're not unique individual aspects. They all tie together. If your staff is aware of what's going on and they're included, they know, they're informed, they're going to do a better job of taking care of the patients in those difficult times, and they're going to feel more at ease than if they don't know, or if they're in the dark. And then when patients are aware of what's going on, their family members and their concerns are aware, then there's the whole atmosphere becomes a little less stressful up on the floor.
So let's just summarize the lessons learned from this specific breach. We haven't talked even a lot about the original cause of this breach, right? It's the phishing. They clicked on a link. So evaluating your training regarding that. I think Jonathan mentioned, don't do that just once a year. Do that on an ongoing basis and make sure people are very aware of what to look for and really second guess clicking on that link every time. And again, considering your patients and staff first in your response plans, really taking a look at those and what you need to do to implement that, not just to document it in your plan. And then having internal and external communications in place, planning for a longer downtime. We've talked a lot about that. And then we can't stress enough testing your readiness, tabletop exercises, and just continue to work on that with your staff and establish that muscle memory so that they won't have to consult a document to know what to do. They'll remember what they did in their training and be able to react.
Laura, let me also point out, we didn't touch on this while it was a phishing attack that led to Ascension. It was actually involved a third party. So there was a third party involved. Vertex, I believe, is if you do the research, you'll find that. So it's it's out there. It's public knowledge. But the point being is our vendors, our relationship with our vendors, and those third parties that are tied to our systems. We need to not just have a BAA in place. That's required. And the language is obviously there and worked out with the third party vendor, but you need to know what their security measures are, what their status is. Are they providing you annually with a SOC 2 report? Are they providing you with an annual with their risk assessment findings? Are they giving you anything that gives you any comfort about the security climate with the vendor that you're working with? And if they don't, you need to ask yourself, why not? And Jonathan and I were talking about this yesterday, and Jonathan, you can jump in. Typically, the vendors that aren't the most cooperative are the ones we find ourselves relying the most on at times because they've been there the longest. But look, when they mess up, we're messed up. And so it's encouraging, and I say that from the CIO role, not from where I am today, but all third party, all vendors, whether it's CloudWave, whether it's someone else, you need to understand what their security measures are that are in place. How are they compliant with NIST 853? Is it moderate baseline? All of those types of things should be very important to you for all of your key vendors that touch your information.
Absolutely. And one thing you can't do is you can't assume that they're doing things right just because there's a BAA in place. And the BAA is not going to protect you if you haven't done your due diligence. I know that I've experienced working with some vendors that actually gave me access into their firewall. And I've talked to engineers at other facilities that have experienced similar things. And in looking inside of the firewall to help them, they had no rules set up. And this was a prominent vendor. So you can't assume that your vendors are doing the right thing. You do need to do your due diligence. You do need to request those documents that Guy spoke about. Another thing I want to say about this slide is the evaluate your phishing staff training. You can do that with social engineering or spear phishing tests. If you're doing external pen testing, I hope you're doing external pen testing and have moved actually to internal pen testing, because you really should be moved to internal pen testing now. But if you're doing social engineering testing with some spear phishing, that is how you can evaluate the effectiveness of your phishing training.
Thank you, Jonathan. So just taking another look at a different breach, the Change Healthcare breach. I don't know if there's anyone in healthcare that's not familiar with this one, but I thought it was still valid to take a look at it and ask some of those similar questions. So just to remind everyone, the cause of this was that the attacker used stolen credentials and there was no MFA in place. So they were able to use those credentials, they accessed the portal, and then they encrypted the systems. And this one took at least a month to bring the systems back online. The total cost has been near $1 billion, and they did pay the ransom of $22 million that was supposedly to lessen the impact of the stolen data. So a huge impact there.
Yeah, as we look at this slide, I don't want anyone to look at it and say, well, MFA, we've got that implemented, we're good. So, because you got to think about all of the systems. Is it implemented everywhere? Are you sure? Hopefully you've got it implemented externally, but are you using geofencing? And if you're using geofencing, do you truly have your guest network isolated so someone can't jump on your guest network and then brute force your account from the guest network? So you have to think about all of the controls that are in place, and are they being effective, not just is the control in place.
And I would point out for Change Healthcare, they are a third-party vendor to many others. And so not to beat a dead horse, but that's again a third-party relationship that has significant impact on many of their customers, all of their customers.
So questions to ask, again, basically all the same questions, right? So these attacks are not unique in nature. They're all attacks. They all bring down your systems. The impacts are the same. So taking those questions that we had from the Ascension attack and asking those same questions. So once you do this for a few of the attacks, you'll have all of these answered. And I hope what you're taking from this today is that you can make some incremental improvements in your process. And as you do this over time, you'll have a more robust cybersecurity program.
And Laura, it's interesting, on the two examples so far, we've seen two of the more prominent attack methods, if you will, social attacks with phishing. You know, the whole premise of phishing email is that we're a trusting people and that you just get too busy and you just trust your email. But the other is when we fail to implement those security standards in our infrastructure, in our systems like MFA and other measures, firewall as well, as Jonathan mentioned, with rules. So there's the technical that we've seen with Change, there's the social that we saw with Ascension. And so we have to be on our A game on both fronts.
Exactly. And, you know, this slide talks about don't ignore the basics. You know, these are the things that any, you know, cybersecurity program will focus on, but to what level do you have these implemented or in practice? So I think we've talked about all of these so far.
Yeah, when we look at the updating of software, Guy and I have created some ways that we can take a look at the baseline of an organization and the patch management. And one thing I'll point out here is even in the best patch management programs, we still find inconsistencies and variations in software. So you want to take a look at, do you have an alternate way to validate that your software is truly up to date? Are you relying on your patch management program, or are you checking that to validate that it is doing what you believe it's doing?
Good point.
So the last one that we want to take a look at is the attack, the Synovus attack. And you may be less, this might be a lesser known attack. It happened in London. It just happened earlier this month, beginning of June. And this, again, to your guys' point, this is a third-party vendor. They do management of blood tests, and this took out the ability to do these blood tests for several major hospitals in London. So therefore, they couldn't do blood transfusions for a lot of their surgeries. And the ultimate consequence was that they had to postpone or delay several thousands of operations and move appointments and or divert to other hospitals. So, and this one, some of the data did get published online, and that takes quite a bit of time to figure out who's impacted, and that's a long-term communication and that needs to happen to those patients.
I find this one very interesting because in my experience in the lab department, you had typically you had the ability to run labs in the department, chemistry and all of those devices, but insurance drives some of those tests. So you may have an insurance provider that says the hospital cannot perform those in-house based on the insurance. They have to be sent to a reference lab. Now, if the reference lab were attacked, and as we talk about outside of the IT department and looking in your incident response plan, this is an example of how you should think ahead of what happens if your reference lab is not available. We experienced some similar things during COVID when you had the inability to do the testing. You may have had to set up some new labs to be able to get those COVID tests performed in the very beginning. But your incident response really should be looking at all of these systems, not just your IT systems, but all of the systems to determine what happens if that third party gets impacted. We have a decision to make. Are we going to divert those patients, reschedule surgeries, or are we going to test those in-house and absorb the expense of not being reimbursed for those tests if that happens? So I think it's a very eye-opening example to help us think beyond that IT department.
Yeah, that's a good point. And Jonathan, when you made the analogy about or the example of third-party incident response, do we know our third-party incident response plan? Have we had conversation with them? So what is their plan in the event that they are crippled and down, for example, Synovus, for example, Change? I think it's important today, with one of the big lessons learned is we need to be invested. And by that, I mean more than just financially, but we need to be invested from a cybersecurity standpoint in our key third-party vendors. It may not be all of them. Maybe your organization identifies 4 or 5, maybe 3. I don't know, but you need to know these kinds of things about those vendors. How secure are they? What are their practices? We talked about that earlier. But what's your incident response plan? What's your downtime? I mean, what's your measurements and your commitment to be back up, and how are you going to do that? How many data centers do you have? All of those things are pertinent questions if, in this case, you've got a reference lab you're depending on, and revenue that you're looking to have to eat up if they're not available. So again, food for thought.
And what is your response to if they do have an event? If we take a look back at the Ascension, it was several days before they actually acknowledged that they had an event. And if you look at a reference lab, typically you're going to have a tunnel for reports and results to come back. And do you shut those tunnels down when you immediately know something, or do you wait until there is an acknowledgement of an event? things to consider when you're building your incident response or improving your incident response plan.
Exactly. So some questions to ask and answer. Have you identified those critical systems? Like Guy said, you may not be able to know your incident response plan of all of your vendors, but which vendors are critical and which internal systems are critical to have a plan in place if those go down. And how would you mitigate an attack from a third-party vendor? And determining if you have a plan to divert patients or to minimize the impact. And then do you have a backup vendor that you can reach out to if one of your vendors is shut down for weeks on end? So just a couple lessons learned from this one, plan for supply chain attacks, really know how you would keep up your operations if one of your third parties is attacked, and what is your plan for that?
And that supply chain attack, planning for that is one that may not be thought about. And if you look, a lot of hospitals keep just a number of days of supplies on hand, whether it be lab reagents or whether it be supplies for the floor, and making sure that you have a backup plan for if that system becomes unavailable. If you're not able to order supplies, what are you going to do?
Yeah, and I would suggest consideration for in your plan for supply chain attacks, working with your supply chain department. Do you have a vendor risk management solution? You don't have to. You can have a vendor risk management questionnaire that you mail out, or email out, and maybe that's an annual basis, and it requires them to submit documents, and it requires them to answer specific questions. You can do search online and find a lot of those tools that are out there, but you need to have a method for determining the strength of your third-party vendor. So just because you've got a vendor that is weak in certain areas doesn't mean you don't do business with them, but you know the risk, and you know what's at stake, and you know what they provide and what information they have access to. So that's, at least you're aware of the scenario that could play out. Just be aware. That's our message.
Absolutely.
Yeah,
it gives you the opportunity to implement compensating controls if you need to. So maybe you don't leave a tunnel up for a support group because you know their security is bad until they need it. So you have a procedure to where they have to call the help desk to spin that tunnel up. So you really, like Guy's saying, if you're aware, then you can implement those compensating controls that are going to help you in the future.
Yeah, I was just going to add, having a third-party risk management process in place. If you've attended any of our webinars before, we talk a lot about increasing your defensibility and decreasing your liability. Having that in place will help in that situation where you saw with Ascension, those lawsuits started early. And if you find yourself in that situation where lawsuits are filed, if you have this these things in place, you can at least increase your defensibility somewhat. And one other way to just evaluate, threats that are happening, and this might not be a specific organization that had a breach, but hopefully everyone is aware of the TAC alerts that we send out that our operations center manages and monitors, and we send out if we think there's a credible threat for you that might need action to be taken. So we break this down and explain the situation in the background. We provide an assessment of that threat, and then we give specific recommendations. So if you're not able to do a full audit of all the breaches that happen, which obviously you can't do that with all breaches, pay attention to these threats, because these are threats that are happening in the moment. And if you can do some remediation ahead of time with our recommendations, then you can potentially save yourself from a cyber attack. An example is one that we sent out yesterday, and this goes to what we've exactly been talking about, the social engineering threat that the FBI sent out yesterday in the Cybersecurity Advisory Organization about specific threats from social engineering. And you can see the recommendations there. At the bottom are all the things that we've been talking about today. So I know everyone's probably in a different state of activity regarding these things and what you do, but hopefully what you took away from today is taking a look at what you're doing today and how you can make improvements.
Yeah, one thing I'll add, Laura, you don't have to do it all today. The good news is hopefully we brought something to your attention that you'll think about and maybe put into your security plan, and you have time. You don't have to do everything today. The main thing is getting it in the plan and having some kind of a plan that you can address it in the future.
Yeah, exactly. There's a question that came in that says, is there a way to make an estimate of costs to the organization that they can present in front of their executives so they can sort of plan ahead? And I'm assuming they're talking about either an estimate of implementing these things or an estimate of the cost of a breach. I'm not sure which one.
Well, there is.
Oh, they said both.
For both, I mean, obviously there are fines that can be levied in the case of breaches where negligence has been found. That's what CMS does, or Health and Human Services. But as far as combating and trying to what the cost is for a breach, you've got to look at labor costs because they're going to go up. We purposefully not focused on IT in this, and we focused on clinical. Well, you've got to up your clinical staffing levels because you don't have information systems, call systems, and all like that. But you also have got to up your IT because while the last of the chain is the systems, you do have to get them back up. And so the vendors that you work with, and there may be new vendors that you have to engage with to help with the IT part, that all has to be in play. But you also have to look at some soft costs, and that is the reputational harm that could come if you're not doing anything. And there is reputational harm out there with change, and they know that. There may be with Ascension, I don't know that, but right now in your organization, if you're a community hospital, you don't want to face reputational harm. That's people choosing to go to another hospital system for treatment and not yours. So there is a cost to that. But if you're not doing a cybersecurity risk assessment, and yes, I am tooting our horns, but you know what? You can go with someone else. But if you're not doing that, then you need to be doing that, because you're not defensible if you don't have a clue what you're doing and what's going on. And so I would start with talking to Cloudwave, talk to other vendors about doing a risk assessment around NIST CSF or NIST 853. I wouldn't do 853 if you've never tackled CSF, but but do those and begin to see where you are. And as Jonathan has said, and I will toot our horn, our approach is more of a maturity model. We want to look at where you are today and help you to start tracking where you're going, where you're moving to. And we have tools that help you track the budget and the asset that you need to address the findings, the gaps that you have. So whether it's us or someone else, you got to understand where you are today. Just giving your senior leadership a dollar amount without a starting point is not going to really help you. But I hope you will inform yourself and your leadership here's where we are, and we've got a lot of work to do.
Yeah, I'm not sure I'm going to be able to add anything to the question because it's a difficult one, and it's going to be dependent on each organization. And like Guy said, there are estimates out there of what a cyber event costs per hospital, and you can go look those up. And when you look at the additional staffing, but one thing I would caution against is relying or thinking you can rely on cyber insurance to take care of everything, especially if you're not doing your due diligence. If it's determined that you haven't done your due diligence, is the cyber insurance going to pay? If you answered the questionnaire that you have MFA everywhere, but you're using geofencing and they come back and find that that was the cause of your breach, can you rely on that cyber insurance? So you really have to consider all of these things when you're trying to estimate that cost.
And we did have one other question come in somewhat related to that. Is there a list of standard items that you should have in your policy, a starting point?
Yes and no. I mean, we can provide templates to you for policies, but for the most part, you start with what are you doing with HIPAA security? And I'll use this example. HIPAA says you got to have a password, but it doesn't say the strength and length, and best practice today is 15 characters. And you may be at 6 or 8 thinking, oh, wow, we're a far piece from there, but that's best practice today, 15 characters on that. But what I would say is, you know what, you can open up Chat GPT or Copilot or any of those things and ask what are important items that should be in my security policies, or what are some items for NIST CSF that should be in our policies, and it'll spit you out a list.
Yeah, and you don't have to, one thing to know about like NIST 853, and like Guy was saying, you probably want to start out with an assessment of a NIST CSF, but you still can take the 853 framework and read through it and start to work towards it. And if you go look at the 853 framework, it's actually going to answer a lot of your questions about what needs to be in your policy. Now, from an assessor standpoint, what I'm going to look for is, what does your policy say? And are you following your policy? Are your controls in place? So it's not that there is a specific on where you need to be cybersecurity wise. When you look at these frameworks, there are suggestions, recommendations, baselines that you need to follow, but a lot of it is adaptable to your organization, unless you're directly involved with a government entity that does enforce that you follow those requirements. So if you go look at that framework and take a look at it, then it will give you a lot of those answers to what you should have in your policy.
And Jonathan and Laura, I know we're hitting the top of the hour, but real quick, what's important and the reason I'm hesitant about saying what should be in policies, you can have the most articulate policy in the world, but when you're asked to produce evidence that you are adhering to those policies and you don't produce that evidence that you live by those policies, then you're better off to have never had those policies, because then you're saying, I don't even follow my own set of rules. So you got to put something together that's appropriate, but you got to live by it too.
And we talk about training, your staff need to be aware of those policies.
Exactly. Well, we're getting close to the top of the hour, so I want to thank Jonathan and Guy for your unique insights, and I think we had a great conversation. Hopefully everyone took away some information that you can think about and make some advancements in your own organization. Feel free to let us know if you have additional questions. Reach out to us. We'd be happy to talk to you further about any of the information shared today. And just a reminder of the upcoming Cybersecurity Insider Program topics. In July, we will give an update on AI in healthcare and how to address policies and procedures and what we're seeing from the threat perspective. In August, we'll talk about cybersecurity metrics and analytics. And then in September, we have our group tabletop simulation scheduled, which we did one last year that was very well received. So this is where we walk through different scenarios similar to what we did today, but really put you in the chair of answering how you would react to those situations. So these are all included in the Insider program, and you're already registered for those. So I think that is it for today. Thank you, Jonathan and Guy, and we will be sending out the recording and the slides to today's presentation. There will be a short survey at the end as you leave if you want to fill that out and let us know your input. So thank you everyone for joining today.
Thanks, everyone.
Thank you, everyone.